Welcome. For those of you that are joining us for the first time, I'm Nona Baker, an MPN patient for 29 years and co-chair of MPN Voice. We are so pleased to have been able to organise our first virtual patient support event for our friends in Ireland, and also everyone else elsewhere in the world who's joined us this morning. For this, we owe thanks to Novartis and Broadcast Media. As you know, we were planning to go to Galway in May this year. Unfortunately, the pandemic got in the way. With a possible vaccine and a little bit of luck, we plan to hold a patient forum in Galway on the 12th of June next year, and very much hope to see you all there. We are so aware of the very difficult times that we're having to endure, especially with the second lockdown, and further cocooning in Ireland and shielding in the UK. This has led to a lot of anxiety, and people are having to live with some very challenging problems and thoughts and feelings. The rules and guidance are different in each country, but the emotional impact is the same everywhere. Today's patient support event is focusing on managing the emotional well-being aspects for people living with MPNs during the COVID-19 pandemic. After the talks, we will have a short break, and then we will have a question and answer session. I would like to extend our thanks to the clinicians from the Mercy Hospital in Cork, St Vincent's Hospital in Dublin, for giving their time and expertise, and also to our three patient speakers, Pat Murphy, myela and Tim Ellis, and finally to our wonderful administrator, Maz Campbell-Drew, for all her help in getting this patient support event up and running. For everyone joining for the first time, I'd like to talk a little bit about MPN Voice. The photographs of Guy's and St Thomas's are there because that's where we started, and we are supported by Guy's and St Thomas's Charitable Trust. From small beginnings, we now serve the MPN community around the world, which is a phenomenal achievement. I would advise you to check out our website, mpnvoice.org.uk. You will find up-to-date, accurate information and links to additional help and support on our COVID-19 page. I would also recommend listening to the relaxation podcasts that have been produced and given to us by Paul, who is a psychologist, hypnotherapist, and MPN patients. They really have helped an enormous number of people. Fundraising. On behalf of all of us at MPN Voice, a huge vote of thanks to myela for organising the most amazing concert of traditional music, marking MPN Voice Awareness Day on September the 10th. It's raised a staggering sum of €3,661 to date. We're so grateful to myela and for getting together some wonderful musicians who gave their time and such a lot of pleasure for MPN Voice. Fundraising is a necessity for us. We all ultimately would like a cure. Funding research is a key to this, and I'm not going to talk any more about that because I'm sure Tim will talk about it in his speech. But if you look at the poster here, fundraising is meant also to be fun. And, you know, I look at all these and I look at the abseil. There's a lady celebrating her 70th birthday, climbing down the wall of St Thomas's Hospital. We have little things that go on, from cycle rides, knitting circles, to the bigger things like marathons. But all I can assure you is that every penny counts. What we want is research to find a cure. And to do that, we will continue to fundraise. Thank you to all of you who help us. It means a lot to all of us. I would like to introduce our first speaker, Tim Ellis. Tim is our Chief Financial Officer, and he's on the Executive Committee of MPN Voice. Tim does an enormous amount of work for MPN Voice and one of our unsung heroes. He's also going to talk about his patient story, as well as what MPN Voice does in terms of financial support and why we do it. Welcome, Tim. Thank you, Tim. I know that you were reticent about talking, but I can tell you that what we've heard gives us all a lot of encouragement. Thank you. I'd now like to welcome Dr. Tara Houlihan, who's the Senior Clinical Psychologist at the University Hospital in Cork. Tara's going to talk to us about emotional and well-being, managing anxiety, of which a lot of patients are struggling with at the moment. Welcome, Tara. Thank you, Tara, for a very informative and helpful talk. I'm sure that a lot of us will gain a lot from what you've just told us. I'd now like to introduce Avril Gleeson, the clinical nurse specialist at the Mercy University Hospital in Cork. Avril's going to update you on how to keep safe and what to expect when you come to clinic. I know in these difficult times it can be a very nerve-wracking experience, but I'm sure you will all get reassurance from Avril's talk now. Thank you, Avril, for a most interesting and informative presentation. I'd now like to introduce Mary Moriarty, the clinical nurse specialist from St Vincent's Hospital in Dublin. Mary is going to talk to us about coping with fatigue and sleep problems. I think both things all MPN patients have struggled with from time to time. Thank you, Mary, for doing this for us. Thank you, Mary. I'm sure that your presentation is going to be an enormous help to all those patients who struggle with fatigue and sleep problems. We're really grateful to you for giving your insights in how to cope with this. And now it gives me great pleasure to welcome Pat Murphy, our patient speaker. Pat, I really admire you. When I first spoke to you about doing this talk, you were a little discombobulated by the idea of being filmed. You told me that you would prefer pigeons on a shelf. But Pat, having heard you in Cork last year, I know that everybody listening today will get an enormous amount from your talk. Thank you, Pat. Thank you, Pat. Your talk really lived up to expectations, and I'm sure so many people will have enjoyed hearing it. I'm now going to introduce Myela, and she's going to talk about her diagnosis with ET and how she became involved with MPN Voice and how that has helped her. Welcome, Myela. Thank you, Myela. And again, so many thanks for all that you've done for MPN Voice since your diagnosis. I would like to introduce our first speaker, Tim Ellis. Tim is our Chief Financial Officer, and he's on the Executive Committee of MPN Voice. Tim does an enormous amount of work for MPN Voice and one of our unsung heroes. He's also going to talk about his patient story, as well as what MPN Voice does in terms of financial support and why we do it. Welcome, Tim.
Hi, everybody. I'm Tim Ellis. I'm 60 years of age and am one of 4 people who sit on the MPN Voice Executive Committee, my role being the Finance Officer. For today, I have been asked, firstly, to provide my own personal experience in living with essential thrombocythemia and myelofibrosis, both more easily referred to by me as ET and MF, and to then explain a little bit about how I became involved with the MPN Voice, where I fit, and on the support we provide. So my journey begins back in 1989, when I was aged 29, having been married for a couple of years and with a healthy 1-year-old daughter. I was starting to feel tired and apathetic. Believing this to be a normal occurrence for such a change in lifestyle, I was shrugging this off and, like most would do, just carrying on. Fortunately for me, my older brother was not convinced, and as a rather unique Christmas present, brought me in for a private health assessment. The results revealed an elevated platelet count, so I was referred back to my GP, where after several further tests that included a bone marrow biopsy, was referred on again some 10 months later to St Bartholomew's Hospital in London. It was at St Bart's that a diagnosis of ET was confirmed, and with a platelet count in excess of 1.1 million, was quickly prescribed hydroxyurea. At the time of diagnosis, a platelet count in excess of 600,000 was considered as critical, a fact that I did not learn until my doctor managed to get mine to below this. I was, of course, naturally concerned about my condition, but particularly so given the close links it has with leukemia and the fact that my father died at St Bart's Hospital at the age of 48 from acute myeloid leukemia. After approximately 6 months, my platelet count reduced and stabilized at around the 350 level. Following on from this, other than the inconvenience of an 8-weekly checkup and the continuing hydroxyurea medication, I proceeded with a relatively normal and active life. 4 years lapsed, and with our daughter aged 5, we decided it was time we planned our second child. Realizing that hydroxyurea was not conducive to achieving this, I switched, after much deliberation, to interferon. This was not a pleasant change, and I experienced the typical flu-like symptoms, headaches, and aching muscles. I got through these side effects with the help of paracetamol, and after 6 months, continued as normal. Our second child, born in March '94, was a healthy boy, and again life continued as normal, or at least so it seemed. My interferon treatment lasted approximately 8 years and was terminated due to my experience with depression. Looking back over these years, I could now see what my wife had been telling me about the interferon side effects. I had progressively become more tired, irritable and withdrawn, presumably due to the continued side effect of the drugs. Having moved to Suffolk in 1994, I was now under a consultant at Ipswich Hospital, and choosing the next drug was not easy. I was faced with a dilemma of switching back to hydroxyurea, aware of the various theories about the drug increasing the risk of acute leukemia, taking just aspirin, with the associated risk of elevated platelet counts, or switching to the new wonder drug, anegrolide. That was obviously relatively new. I chose anegrolide, and armed with this new medication and my experience of depression behind me, my next 4 years continued with relative normality, albeit with rather more muscle joint ache pains than I would have liked. I accepted these aches and pains as the consequences of getting older, but after 2 to 3 years on this treatment, I became aware of the increasing concerns that anegrolide might cause a transformation of my ET condition into the more serious myelofibrosis. After much deliberation, I chose to stick with anegrolide until the beginning of 2005, when, after undertaking a long overdue bone marrow biopsy, it was discovered that my condition had now progressed to level 4 myelofibrosis. Needless to say, this was devastating news, particularly so given that my wife had just discovered that we were rather unexpectedly going to have a third child. I opted for a spell on interferon, whilst awaiting for a hastily arranged appointment with Professor Green at Addenbrooke's. Needless to say, given the outcome from my previous experience with interferon, my choice of drugs was not well received at home. My appointment with Professor Green went well, and after reassurances that there were no real evidence supporting the theories of hydroxyurea developing into leukemia, I went back on to hydroxyurea. At this stage, I was not experiencing an enlarged spleen, or any of the other conditions that are often found at this stage of my condition. My mistakes. Well, going from 1989 to 2005 with no bone marrow biopsy was, in my view, a big mistake. Choosing and sticking with anegrolide was another. However, I do realise that we are all different and that we tolerate and react to these various drugs in very different ways. So for some, anegrolide might be the best course of treatment and is clearly a decision that you and your consultant should make together. Following the diagnosis of myelofibrosis in 2005, until the beginning of 2010, I remained on a relatively low dose of hydroxyurea and attended my regular 12 weekly checkups at Ipswich Hospital. This was supported by an annual appointment at Addenbrooke's Hospital, during which I undertook further bone marrow biopsy tests. In February of 2010, my blood count started to become unstable, with hemoglobin levels dipping below acceptable levels. After various attempts at controlling this, I eventually stopped my hydroxyurea medication in July 2010, when I learned that my fibrosis condition had deteriorated to a point where it was becoming unmanageable with drugs alone. The latter half of 2010 was very worrying times, as we explored how best to manage and control my condition. At this stage, I was feeling particularly poorly, and the prognosis given to me was that I could die within the year. To fight this, I really only had two options. The first being to opt for blood transfusion, providing blood top-ups as required, and the second was to attempt a bone marrow transplant. Given that the first option could only ever be short-term, I opted for the transplant as soon as possible. The process of finding a donor was completed by January 2011, and after a few false starts, I eventually had a stem cell transplant in June 2011 at Addenbrooke's Hospital. My transplant went well, and while I did endure some nasty complications and side effects, 9 years on, I feel pretty good. I hope that story wasn't too long-winded, but it was the reason that in 2005, I decided I wanted to commit myself to try and better understand the disease. I had learned that a newly formed MPD support group had been established by Dr. Claire Harrison, now Professor, from Guy's and St Thomas's Hospital, and so I decided to make contact. I quickly realised that there was immense need for such a group, so decided to become involved. From its formation, the group was run by a steering group made up of both medical professionals and patients, with an aim to provide support to patients across the UK and to also help the medical community gain a better understanding of the condition and to even help in finding a cure. 7 years later, and with a couple of name changes along the way from MPD Support to MPD Voice and to now MPN Voice, the group has developed into a globally recognised charity under the umbrella of GSTT. The outset of COVID-19 at the start of the year led to an important change to the organised structure of the MPN Voice. In order to become more responsive to the pressures that COVID-19 was starting to present, a new management structure, as you can hopefully see now on the screen, was put in place. This consisted of an executive committee comprised of Professor Claire Harrison, John Mathias and Nona Baker as co-chairs, and myself as finance officer, supported by 3 additional committees, namely a management committee, a fundraising committee, and a clinical advisory committee. I mentioned earlier my main role as finance officer. This sounds very grand, but in truth, it's really about trying to understand and present the finances of the MPN Voice charity from the data provided to us by the Guy's and St Thomas's charity team. This sounds as though it should be easy, but in reality it is not. Least of all because GSTT look after approximately 180 similar charities, with ours being probably in the top 10 of the most active. This leads on nicely with me providing you with a small insight into our finances. For a small charity with relatively modest funds and income, I genuinely believe we provide a wide range of support to the MPN patient community, support which at times is greatly needed. Income received through fundraising, legacy receipts, donations and corporate sponsorship would normally provide for an annual income of approximately 100,000. We of course endeavour to make the best use of these funds, and our expenditure generally matches the £100,000 annual receipts. There have been years when income has exceeded these sums, and we normally reserve these for funding grants that we provide to what we consider as worthy causes. Expenditure for this and the previous 2 financial years is likely to be £480,000, taking out £887,000 grant payments we have provided to the epidemiology study Mosaic and the drug trial Mithridate. This equates to the £100,000 approximately per annum figure mentioned. The next slide shows the breakdown of expenditure for this period and demonstrates why the continuation of funding is so vitally important. From this slide, you will see that our priorities are heavily focused on meeting the objectives set for MPN Voice. These can be seen as patient group forums, which prior to this year would have been face-to-face meetings, but owing to COVID-19 are now held online. The provision and distribution of drug and disease booklets, for which there is a considerable demand. Health Unlocked, which has over 2,000 registered MPN Voice users worldwide. Social media, news updates together with website maintenance, and the organisation and setup costs in support of fundraising. And also, not least, buddy support, for which we have 69 tier volunteer buddies on standby to help. The truth is that these sums do not reflect the full costs associated with running these initiatives. Many hours of unpaid effort is put in both the patient and medical members of the 4 committee teams. We owe a huge debt of gratitude to these people, as the MPN Voice charity would not exist without them. At the start of the UK COVID-19 lockdown, the financial impact on the charity's income stream looked quite alarming. Measures put in place to prevent this have, however, been working. So I'm pleased to report that due to the generosity of some of our members in supporting a special appeal for donations back in April, and the tremendous efforts being made by our invigorated fundraising committee, we remain strong and able to continue with the support we provide. So that's it from me. Thank you for listening, and I do hope that you've enjoyed my presentation.
Thank you, Tim. I know that you were reticent about talking, but I can tell you that what we've heard gives us all a lot of encouragement. Thank you. I'd now like to welcome Dr. Tara Houlihan, who's the Senior Clinical Psychologist at the Mercy University Hospital in Cork. Tara's going to talk to us about emotional and well-being, managing anxiety, of which a lot of patients are struggling with at the moment. Welcome, Tara.
My name is Dr. Tara Houlihan, and I'm a Senior Clinical Psychologist at the Mercy University Hospital. I work within haematology and oncology departments. In this presentation, I'm going to talk to you about the psychological impact of COVID-19, look at strategies for managing emotional distress you might be experiencing now or in the future, and talk about ways to boost your well-being and live well in the uncertain world we find ourselves in at the moment. There is a lot of challenges we have faced so far and continue to face with an evolving COVID-19 situation. For example, we cannot have the same contact with loved ones or our trusted supports in the same way as before. There might have been changes to our jobs. For example, we may be working from home. We might do a lot of our work virtually using online video forums instead of face-to-face meetings. We might have been furloughed, or for some of us, our jobs may not have survived the lockdown measures put in place. There have also been changes to healthcare. For example, we might meet our healthcare team virtually now instead of face-to-face. Appointments may have been cancelled or postponed, and we might be reluctant to attend appointments due to fears of contracting COVID-19. We need to be more vigilant on a daily basis. So just like a meerkat looking out for threat, we can find ourselves thinking of actions now that we wouldn't have before. So for example, maybe thinking of what our hands might have touched and whether we washed them. Thinking how close we are physically to people. Thinking about where we go. We may also experience challenges in getting our basic needs met. For example, needing to ensure we have enough supplies of food and essential goods. For people who are cocooning, maybe having difficulties getting food delivered, having to make arrangements with banks to manage mortgage repayments, and so on. And with all of these changes to our lives, we are also having to deal with not knowing when this will end and what the future might look like. What we know from outbreaks of infectious diseases in the past, and also from what patients tell us now, is that it can bring up a whole host of emotions, and it is very rarely that just one we experience. Actually, it's very common for several or all emotions to be part of the picture at any one time. So the types of feelings we may be experiencing include fear and worry, both for our personal safety and that of our loved ones. We may be worried whether we or our family members or friends might get sick. And this can be particularly distressing in the context of also having an MPN. Some people might be feeling lonely and isolated due to cocooning, social distancing and limited social contact, or maybe not being able to have visitors if you're in hospital. You might have felt annoyed about having to remain at home as much as possible, not being able to do the same things, having had to cancel plans, holidays, and so on. You might feel sad about things you've missed out on, the changes to our lives. And some people may be feeling sadness and grief about loved ones they might have lost during this time. A build-up of all of these emotions can be overwhelming, and we may find it difficult to cope. We might also feel like we've lost control of our lives and feel hopeless about things changing in the future. One of the first experiences some of my colleagues shared with me was that they noticed that their sleep suffered when they became aware of COVID-19. For example, they were finding that they were waking up more frequently during the night. They were having difficulty falling off to sleep, and for some, they were waking up very early in the morning time. You may also notice that you eat more or less now than before, and there may be a change in your weight. So there are changes in our eating patterns. I found that my concentration was all over the place when I first learned about COVID-19, and particularly when the country was about to go into lockdown earlier this year. So much so that on my way home from work that day, I filled my car with diesel instead of unleaded petrol. So our minds can be very easily distracted when something as big as this happens. We may also have noticed sensations of anxiety in our bodies. For example, our muscles might feel tense, we might have aches and pains, we might find it difficult to relax, feel tired, or our heart might be beating faster. And what you also may have noticed is a change in your behaviour. Maybe you are avoiding people, places, or situations now that you wouldn't have before, because maybe you feel more anxious in these situations now. The first thing to note is however you are feeling is normal. This is a time that looking after yourself is so important, not only for your health, your overall health, but particularly for your mental health. I'm going to talk to you now about some self-care habits that will put you in a stronger position to manage distress and to tolerate uncertainty. The first is to create a new routine. A routine provides structure to your day and also increases your sense of control. So, for example, aim to get out of bed at the same time each day. Plan your day in chunks of time. So, for example, allocate time for meals, work, study, exercise, and so on. Write a realistic to-do list and check off items as you complete them. Take care of your basic needs. So that will be looking at your diet, maybe the amount of fruit and vegetables you consume on a daily basis, the amount of processed food we eat, and aiming for a healthy balance in our diet every day. Getting good sleep is also very important for your self-care. Trying to have a regular routine, so maybe getting up at the same time and going to bed at the same time every day. And knowing how to relax. So, knowing how to wind down so that you're better able to get yourself ready to go to sleep. Try to limit your intake of caffeine, tobacco, and alcohol, because they are what we call short-term coping mechanisms, and in the long run, they don't benefit our health. Also, it is easy to mistake signs of anxiety for too much caffeine. So it would be about slowly switching to decaffeinated coffee, for example, and you should notice the difference within weeks. Getting out and getting active can be a real boost to your self-care. So that could be walking outside, it could be gardening, it could be running a marathon if that's what you want to do. It could be yoga, doing daily stretches, whatever will interest you and get you moving. Make sure to include time for hobbies and interests every day, as it gives us a break from the routine of day-to-day life. So it might involve rediscovering a hobby you used to enjoy. Being interested and engaged in something is just so beneficial. You may have heard already, but try to stick to reliable sources of information about COVID-19. So, for example, the HSE website would give really accurate information. And seek updates only once or twice daily. Stay connected with others and maintain those positive relationships. And I suppose now we have to find creative ways to do this. So, for example, it might be setting aside a time to watch a film together with your friends, with your loved ones, on Netflix, for example, but remotely. So, arranging to do this over Zoom and organising to chat about it during the film and afterwards. Several work teams I know now organise to have regular coffee breaks via Zoom. To give that informal contact we had before COVID-19 and we miss now. Some people can find it very difficult to look after their own self-care. Maybe they feel guilty about taking the time for themselves, and some people can find that they're too busy. And what I'd say is remember the safety announcement when travelling on a plane. So to put on your own oxygen mask first before you go and tend to somebody else. The same is true for self-care. We need to look after ourselves first, and then we can look after other people. Planning ahead and putting self-care activities in your daily routine can make it more likely that it will happen also. And it might not be easy, but once you notice the benefits, you'll see that it's worth it. So managing emotional distress and your psychological well-being during this time is as important as managing your physical health. I'm going to give you some suggestions on several things you can do if you feel anxious, if you feel panicked, if you feel scared, or if you find it hard to cope. And you might decide to take note of these and other techniques you find helpful in a well-being plan. People tell us that they find it helpful to have techniques recorded and in a safe place to access easily when they feel distressed. So you'll see in this wellbeing plan, it is broken into different sections of strategies that might help you. I am going to talk to you about things you can do that take about 30 seconds. Things you can do in about 3 minutes, and things that might take 30 minutes or longer. So the 30-second fixes are quick fix emergency actions. So this could be taking a few slow, deep breaths, maybe breathing in for a count of 3, breathing out for a count of 3, and doing this several times. Sitting on a chair and focusing on the sensation of the chair pressing into your back and your bottom. Noticing your feet in touch with the floor. Maybe looking out of a window or doorway. What can you see? What can you hear? Anything new or unusual? Really bringing your focus to your senses. It can help to take a few sips of cold water, focusing on the cooling feeling as you swallow it. Even better if very cold. And think of 2 things that are just about okay right now. Examples of 3-minute fixes are maybe doing a quick brain workout. So maybe doing a word search or a crossword. Maybe phoning someone for a quick chat. Making yourself a hot drink and sipping it slowly, feeling the warmth of the cup in both hands. Maybe listening to a favourite piece of music, something that will soothe you and be uplifting depending on how you feel. And 30-minute fixes. going out for some fresh air if you can, doing something mindful. So focusing on one thing you were doing, such as eating, walking, maybe having a bath with music and candles. Using a well-being app, maybe Headspace or Calm. So maybe doing a proper sort out in your house. So maybe clearing out a cluttered kitchen, organising a drawer or a wardrobe, and feeling the satisfaction of having done something. Maybe preparing a tasty meal and really savouring every mouthful. Also for you to know that there is a free online program called Stress Control Training running until December and hopefully again in the future. And this consists of six video sessions streamed live by Dr. Jim White, who's a clinical psychologist. And the program teaches you practical skills to manage emotional distress. I would recommend keeping an eye on the Stress Control website for dates, and I'll include this at the end in the resources section. We know that learning to get a handle on worries, anxieties, emotional distress gives us relief. However, it doesn't necessarily guarantee that we will live well and feel positive emotions such as joy, excitement, happiness. Well, what we know is that well-being comes from living a life with a balance of activities that give you feelings of pleasure, achievement, and closeness. We know that when this is out of balance, it can affect your mood. So, for example, if we spend a lot of time working and little time for pleasure or socialising, we can feel low or isolated. COVID-19 has changed our normal routines and daily activities, and we can find that the things we did to look after our well-being have become difficult. However, it is important to be creative and plan activities into your daily routine. For example, plan to do things each day that are pleasurable to you. This could be reading a book, it could be having a coffee, watching a favourite TV programme, going for a walk. Also, having achieved or accomplished something can leave us feeling really good about ourselves. For some people, it might be completing an exercise regime, it could be doing housework, it could be mowing the lawn, whatever it is that gives you that sense of achievement. We also need connections to thrive and flourish in our lives. So include at least some activities every day that are social and involve other people, remotely of course. Check in with yourself and ask yourself every day, what did I do today that gave me a sense of achievement, pleasure, closeness with others? Did I get a good balance, or what can I do differently tomorrow? You might also be interested to know that the HSE has launched an online program, Minding Your Wellbeing, and this provides tools and guidance to develop and maintain a positive outlook during COVID-19. So in summary, COVID-19 has challenged our lives in lots of ways, and it is completely normal to be feeling a wide range of emotions as a result. Managing anxiety and your emotional well-being during this time is as important as managing your physical health. We recommend focusing on your self-care, having a daily routine, attending to your basic needs, staying socially connected with others, watching your exposure to social media and your intake of alcohol and caffeine, and also making sure you keep up your hobbies and interests. Remember, nothing lasts forever, and this will pass. It is just one chapter in our lives. It will not define us. Here are some links you might find useful. There's a link for relaxation, mindfulness, deep breathing exercises. And I've also included the 2 links for programs I've mentioned. One is the stress control program, and the other is the Minding Your Wellbeing program. Thank you very much for listening today. I hope that some of what I've spoken to you about may be helpful, and I wish you well.
Thank you, Tara, for a very informative and helpful talk. I'm sure that a lot of us will gain a lot from what you've just told us. I'd now like to introduce Avril Gleeson, the clinical nurse specialist at the Mercy University Hospital in Cork. Avril's going to update you on how to keep safe and what to expect when you come to clinic. I know in these difficult times it can be a very nerve-wracking experience, but I'm sure you will all get reassurance from Avril's talk now.
Welcome everyone to our event here today, and thank you for listening in. My name is Avril Gleeson, and I'm a haematology clinical nurse specialist here in the Mercy University Hospital in Cork. I work alongside one of the consultant haematologists here who specialises in looking after patients with myeloproliferative neoplasms. Today I'm going to take some time to talk to you about how to keep yourself safe in the current COVID-19 climate and what to expect when you come into your hospital appointment or into your day ward for a venesection. So, to begin, I will discuss some helpful hints and tips on how to keep yourself safe and how to make informed choices about the safety of your daily activities. First on the list is hand hygiene and washing your hands properly and often. This involves either washing your hands with soap and water or using a hand sanitizing gel. I'll speak a little bit more about hand hygiene in a small while. Next is practicing social distancing. This is by far one of the most important things you can do to protect yourself by social distancing and keeping more than 2 meters or 6.5 feet apart from others. You need to keep the number of people that you have face-to-face interactions with as low as possible. Next is cough and sneeze etiquette. It is very important to ensure that you cover your cough and your sneeze and to dispose of your tissue in a bin immediately afterwards. You will need to carry out hand hygiene again after sneezing or coughing. Another important aspect of keeping yourself safe is the wearing of a face covering. As I am sure you are all aware, that is a legal requirement now in Ireland to wear a face covering in places where you cannot ensure more than a 2 meter distance between people and in public indoor places such as shops, hospitals and on public transport. I'll talk again a bit about how to wear your face covering correctly in a moment. Next, another important aspect of keeping yourself safe is keeping your environment clean and cleaning frequently touched surfaces. So this applies to us at home and in our work environment. These surfaces that would be frequently touched include door handles, phones, toilet handles and flushes, your computer, your desk at work. Another important aspect of keeping yourself safe is having or considering your own risk factors and avoiding unsafe activities. So when I talk about looking at your own individual risk factors, these may be things that include your age, your underlying illness, or other illnesses you may have, such as heart disease or lung disease, obesity or diabetes. These are very important factors to take into account when considering or making decisions about different activities. When deciding to undertake an activity, for example, calling to a friend's house or going to the shop, it is important to ask yourself a few questions. How many people may I encounter at this visit? Will people adhere to social distancing? Am I in a position to ask them in advance if they have any symptoms of COVID-19? It's assessing the risk versus the benefit of the activity. The more people you interact with and meet, the higher the risk of getting COVID-19. Another aspect is the activity indoors or outdoors. When activities aren't taken outdoors, we are able to social distance correctly. Another aspect of keeping yourself safe is keeping yourself active and healthy and your mind busy. We need to look also at measures to reduce your risk when you are out and about. For example, if you are going to get petrol or diesel, when you're using the petrol pump, ensuring that you sanitize your hands after touching the petrol pump, or in and out of a shop, or using a gate, sanitizing your hands again after touching these surfaces. Another handy tip for when you're out and about is to ensure that you have your hand sanitizing gel and a face covering with you at all times. It is handy to have a set in the car, but also in your handbag or your coat pocket when you're out and about. Another top tip, and one to keep in mind when out and undertaking your activities of daily living, is to assume that everyone has coronavirus, and also to act like you have the virus and that you don't want to pass it on to anyone else. This is very helpful when doing your daily jobs around and when you're out meeting other members of the public. Next, I'm going to talk about hand hygiene, and this is in the context of keeping yourself safe and also when coming in to attend hospital appointments or attend the day ward. I'll just run through the steps of how to use the hand sanitizing gel correctly, and I'll also speak then about taking on and putting off your face, or putting on and taking off your face covering. So we only use hand gel when our hands are clean and not visibly dirty. If they are visibly dirty, you will need to use soap and water at that stage. So I just have some hand gel here for the purposes of demonstration. So pop on your gel and ensure all the surfaces of your hands are wet with the alcohol-based gel. I'm rubbing my hands palm to palm, front to back, interlacing my fingers and getting in between the finger webs. Then I'm interlacing my fingers, rubbing the backs of my fingers and my knuckles on both sides. This should take 20 to 30 seconds to complete in full and correctly. Then I'm getting the tips of my fingers and rubbing them against the palm of each hand. And then I'm ensuring I clean or make sure that my thumbs are cleaned also with the gel. And lastly, the wrists. Let's start with the wrists and make sure that they're done as well. So at this stage, the gel needs to be dried in fully before the hands are correctly sanitized. And at this stage, my hands has absorbed all the gel. So another tip at home is to have your hand sanitizer inside the front and back door of the house, so that you, on coming into the house, will use it before touching any other surfaces within the house. Also, once our restrictions allow us to have visitors in the house again, it is important to encourage any visitors to the house to use the hand sanitizer on entry into your household. And again, as I said, it's important to carry one on your person at all times. Now, next I'm going to talk about how to wear a face covering correctly. So as I said, it is a legal requirement now in Ireland to wear a face covering indoors. Now, I'm sure we're all used to wearing them at this stage. However, we need to be wearing them properly to get the proper benefit of them. So, first of all, when wearing a face covering, you should clean your hands, as I just demonstrated, with your alcohol gel. Your face covering should be kept in a little plastic bag that is sealable and waterproof. I have a face covering for the purpose of demonstration here today. So I have my hands cleaned at this stage, as I've already showed you. I'll take my face covering out of my plastic bag, and I'm going to put it on. So once my hands are cleaned, I can put my face covering on using the loops. You should never use the front of your face covering to put it on. You use the loops to attach them around your ears, making sure that it fits snugly and comfortably. It should go right under your chin and up to the bridge of your nose, making sure that there are no gaps at the side. So I'll just apply the face mask to show you. So I'm just looping it around each ear, and I'm going to adjust it without putting my hands on the front of the mask, just right up over my nose and under my chin, and checking the sides that there is no gaps. Now my face mask is on. I do not touch the front of the mask at any stage, if at all possible. Once it is on, I should not touch my mask. If I need to touch my mask for any reason, I need to clean my hands again afterwards. Now, when I'm removing my mask, I will use the ear loops to remove the mask. So I will take one ear loop off and the other ear loop off, and I will replace it back into my Ziploc bag or my sealable plastic bag. Again, I need to undertake hand hygiene after doing so. Just a few pointers about wearing a face covering. It's important that you use the loops to put it on and take it off, and that you have no gaps at the sides, that it does not sit around your neck, that it does not sit above your mouth, that you do not wear it at the tip of your nose. It needs to come right up to the bridge of your nose, that you do not wear it below your nose. It is important to clean your hands before and after putting on and taking off your face mask. You should wash your face mask daily, and you should not use a face mask that is soiled or wet. Again, if you touch the face mask at any stage, you need to clean your hands. If you're using a disposable mask, your disposable mask can be put into the bin, into the household bin immediately, or as soon as you get home, it should be put into the bin. So next I will talk about is what to expect when you come to clinic. So there have been new practices put in place in response to COVID-19 here in the Mercy Hospital, as with all hospitals nationwide in Ireland. We have different ways of managing appointments so as to ensure the safety of patients coming into the hospital. The treating hematology team will look at the clinics and decide whether a patient is for a physical attendance at their clinic appointment or whether they will be scheduled for a telephone consultation instead. Patients will be notified by letter whether their appointment is a physical appointment or a telephone consultation. Here in the Mercy Hospital, as I'm sure is the case with a lot of the hospitals nationwide, patients for telephone consultations are required, for hematology telephone consultations, are required to have their bloods completed in their community in advance of this appointment. So this would be either getting your bloods done with your GP in your medical health centre or attending the blood room in the hospital in advance of this appointment. The telephone consultation will take place this usually the same day as the outpatient clinic runs. And in much the same manner as what it would if you were physically attending the appointment. You will be assessed over the phone by one of the medical team in relation to your MPN and your current health status. They will talk to you about any MPN symptoms, carry out an MPN symptom assessment if required, and also talk to you about if you have any side effects associated with your MPN treatment. At this stage, your bloods will be reviewed and a plan for future appointments will be made. Patients who are physically attending the hospital for their hematology outpatient appointment will, in their appointment letter, receive patient information, which is necessary to have looked at prior to your arriving to your appointment. So in this patient information, there is a self-assessment to be undertaken on the day prior to your outpatient review. This self-assessment involves assessing yourself for symptoms of COVID-19, such as fever, shortness of breath, cough, loss of smell, loss of taste, new vomiting or diarrhea, and any potential exposures to COVID-19, international travel, or a household member being sick, waiting for a COVID-19 swab, or waiting the results of a COVID-19 swab. Here in the Mercy, patients receive a telephone confirmation call in advance of their physical attendance at the outpatient clinic also. So on the day of your appointment, I would advise patients to maybe put on their face coverings when they're leaving their car, so as that they have them on comfortably and securely in advance of coming to the hospital building. So we had asked patients to arrive at their allocated time and arrive alone if possible. However, if you need assistance that for mobility or hearing or sight issues, the person accompanying you will have to follow the guidelines as outlined. On arrival into the outpatient department or into the hospital building, you will need to wear your face mask correctly. If you forgot your face mask on the day, the reception or security guard will provide you with a face mask. You will be asked to clean your hands with the sanitizing gel, and disposable gloves will not be allowed within the hospital or the outpatient department. When you are waiting to be seen by your haematology team, the social distancing practices are in place within the outpatient department, and we do endeavour to see all patients on time. However, due to unforeseen circumstances, there may be delays. On departure from the outpatient department, you will be asked again to sanitize your hands on leaving the building, and you can remove your face mask outside of the building. Again, if you have a disposable face mask, it can be disposed directly into the bin, and if it is your reusable face covering, you need to pop that into your Ziploc bag again. So I would encourage all patients to attend their, I would encourage all patients to continue their current medication and attend their hospital appointments, because keeping good control of your MPN is priority, especially at these times. They are very unsettling times for everyone, regardless of where you live or what restrictions you're under at the moment. However, again, I would encourage you to keep contact with your haematology team, and if you have any questions in relation to your MPN and others, your MPN and COVID-19, to speak with them. Thank you very much for your attention today.
Thank you, Avril, for a most interesting and informative presentation. I'd now like to introduce Mary Moriarty, the clinical nurse specialist from St Vincent's Hospital in Dublin. Mary is going to talk to us about coping with fatigue and sleep problems. I think both things all MPN patients have struggled with from time to time. Thank you, Mary, for doing this for us.
So hello, my name is Mary Moriarty, and I am the clinical nurse specialist in the psycho-oncology service in St Vincent's University Hospital in Dublin. I'd like to say thank you to MPN Patient Voice for inviting me to come along today and to talk to you about fatigue and sleep challenges. This is a general presentation, and, I suppose, I hope there's something in it for everybody, but not everything will be relevant to everybody. But I hope you can get something from it. And it's more or less a whistle-stop tour, really, of the topics of fatigue and sleep. There's a lot more information in the literature than I have time to go through today. So thank you and welcome. So even though you're part of a group of people who are living with MPN, this is a very individual journey or experience. So bear in mind as I'm talking today that, your experience is individual to you, your disease, your treatment, your own body and how you respond to treatment. And bear that in mind too when maybe you're meeting with other people, and it's the most natural thing in the world for us all to compare ourselves with others, but sometimes it might be helpful to remember that what we're experiencing is individual to us. So what is fatigue? Well, we know from the literature and the research that fatigue is one of the most distressing and unpleasant challenges for people with MPNs are living with. We know it's the most frequently reported, and it's the most severe symptom that people talk about. And when I would meet with people in my work, what they usually tell me is that it feels as if, they're running on an empty tank, or, their battery feels like it's never really full. And that actually, no matter how much sleep you have, you never feel as if you're rested. The other thing about fatigue is that it's often isolating. It's difficult to describe how you feel to other people. And so sometimes it leads to a sense of isolation. I often hear people telling me that, people tell me, oh, you look great, but I don't feel great. I feel pretty lousy. And that can be quite frustrating. So, people don't always look like they're experiencing fatigue, and it's not something that can be visibly seen to others. What are the effects of fatigue? Well, a lot of the time people don't report fatigue to their medical team or their nursing team because people think that it's inevitable and that nothing can be done about it. But fatigue does interfere with your quality of life. It can interfere with relationships. It can interfere with your functioning and your enjoyment of life, and also, with the sense of achievement, because there's often maybe difficulty completing, tasks that in the past you would have completed very quickly and very easily. So, it has an impact on quality of life and your enjoyment. So what are the causes of fatigue? Well, there's multiple causes to fatigue. Usually the illness itself can cause a certain amount of fatigue. And if anemia is present, that will cause fatigue as well. Very often it's the side effects of any treatments or medications that you might be on. Sometimes it's other medical conditions, like, if you have some thyroid functioning difficulties or chronic kidney disease, diabetes mellitus, those things can cause, fatigue as well. Also, the literature would tell us that people who are or have an elevated BMI also struggle with fatigue more so than people who don't have an elevated BMI. Alcohol and tobacco seem to play a role as well. And there's also a connection between low mood, depression and fatigue, and low mood, depression and poor sleep, low mood, depression and concentration challenges. Also, stressful life events and sometimes daytime napping can interfere as well, even though that might feel like the right thing to do. But sometimes having a nap during the day can interfere with your night's sleep, and that can interfere with your feeling of fatigue. Normally, when we can all experience normal tiredness after we've had a particularly busy week or a particularly busy time or a stressful time at work. And usually that fatigue is corrected by a period of rest or a holiday or a weekend where we have a good night's sleep and we can recharge our batteries. But with fatigue, that doesn't seem to happen. Very often what happens is that people who experience fatigue tend to maybe save up fatigue or store it in the money bank. And that's not often a helpful way to manage fatigue. So I'm going to be talking a little bit about what we can do about fatigue. So I talk about tackling fatigue. So by doing that, we're tackling or managing fatigue. We're going to manage sleep, and we're going to talk about support with low mood and anxiety. So what can you do? So I suppose in some ways what I want to say at this point is this is a very brief and short presentation on fatigue. And that, I work with people and sometimes I meet them weekly for quite a number of weeks in the hospital to try and help with fatigue management. So this is very brief, and I want to, make sure that that's very clear in my presentation, that fatigue should really be assessed properly by your medical team, and it warrants a much bigger and longer conversation than I'd be having with you today. But there's ways that you can kind of take a management position with regard to your fatigue. So the first thing that I would say is I'd always plan my hospital appointment. And I suggest a lot of the time that people use a notebook and write everything into the notebook. All your questions that you might have for your medical or your nursing team, even if those appointments, as they are at the moment during COVID, virtual appointments, always have your notebook ready so that you can write the answers to what the medical team or the nursing team tell you into your notebook, and then you can refer back to them later on. But plan out your appointment well in advance, for weeks in advance of your appointment. Put into your notebook what comes into your head, what questions you have. If you're experiencing fatigue, write that in and do tell your team about it. Another way of managing fatigue would be to plan out your day and your week. And in another slide, I'm going to be talking about planning, pacing, and prioritizing. There might be a role too for having an action plan for the day or the week that's achievable. Very often what happens when people are experiencing fatigue is that, we decide, okay, on Monday morning, I'm going to go out and I'm going to do this, that, and the other. And then you go out and do this, that, and the other, and you use up a huge amount of energy, and then you're exhausted. And then we get into a vicious cycle of thinking that actually there's nothing can be done about fatigue. It's never going to get better, when in actual fact, something can be done. So when I talk about pacing and prioritizing and planning, I'm talking about planning out your day and planning out your week, prioritizing what's the most important things and trying to do the most important things when you have the most energy. And in the chronic disease self-management program, or the Cancer Thrive and Survive program, we often talk with people about asking yourself the following 3 questions in terms of planning, pacing, and prioritizing. And the first one is, does it have to be done by me? Does it have to be done today? And is it important? And those 3 questions can be really helpful to help you prioritize what you should do today or this week, or maybe not to. So just maybe, even if you want to just jot that down in your notebook and keep that as a reminder to yourself, when maybe you're feeling a little bit overwhelmed and you're feeling exhausted. It might be a good way of you managing yourself and the way you use your energy. So just some coping strategies. So I talked about pacing, being careful not to just pick an arbitrary day or date and to start exercising or to start doing things. Usually, it's much more helpful if you can take a stepladder approach and, very, very gradually increase maybe your activities. All of this would be in conjunction and with your medical team and, chatting with them first before you make any changes to your routine. I'll talk a little bit later on about communication, but it really can be helpful to communicate both with your medical team, your nursing team, but also with your family and friends, because they can be very supportive in terms of helping you to manage your fatigue and manage the energy that you have. And that might be around getting some help with household chores, maybe getting, some help with transport in and out of the hospital or to the supermarket or whatever is helpful, maybe some help with babysitting. But I always say to people, make sure you take a break from fatigue as well. Distraction and not thinking about what's happening in terms of fatigue can be really helpful as well. And also having a look in your community around what resources might be available to you, or indeed at the moment having a look online and just to see if there's any more information or educational opportunities that might be available to you around fatigue and coping strategies. When I talk about taking a break from fatigue, fatigue can be, as I said earlier, very isolating, and there can be a link between fatigue and low mood or depression. So it's really important that, if we can, we try and, engage in enjoyable activities and fun activities, and we have some fun with whatever we're trying to live with and whatever our limitations are. So what are the enjoyable activities that are available to you right now, even if we are restricted? Link in with friends using Zoom or video or FaceTime, and try your best to stay in contact with people. The other thing that might be helpful at the moment is to, engage or, get in touch and play card games, doing some reading, linking back in, looking at movies that you enjoy, and maybe doing an activity that you've wanted to do for years that maybe you just didn't have time to do. And this might be an opportunity to engage with that. Card games can be a really good way for people who play bridge. There's online bridge now, and that can be helpful because I know a lot of people are missing their bridge and their bridge clubs at the moment. Lots of people are missing lots of things. So in a way, what we have to be is try and be creative, and we may not feel like being creative, but sometimes if we can engage in some creative activity that's safe for us to engage in right now, it can be really helpful. I just want to mention for a minute, persistent cancer-related fatigue. So for anybody who is here or listening, if you've been through a treatment like chemotherapy or cancer treatment, and you're finished your treatment 6 months or more, and you're experiencing persistent fatigue, it's worth having it assessed properly. The research and the literature would tell us that cognitive behavioural therapy can be really helpful in challenging and managing persistent fatigue that continues for a long time after treatment is finished. And I would never ignore any new or unexplained symptom or pain. I'd always have that checked. It's really important. So with cognitive behavioural therapy for the persistent cancer-related fatigue, it challenges and it looks like it examines and educates us in our thoughts and how our thoughts impact on the choices or the behaviours that we engage in, and our emotions and how we feel, and also our body sensations, and how we might get into sort of negative thinking or circular thinking about our fatigue. And that can be really helpful, and a really helpful way of helping people to manage persistent cancer-related fatigue. And that's just a cross-sectional formulation of how CBT works. But again, this is really brief. That's just a whistle-top kind of crash course. It really, it warrants a much bigger conversation than we can have here today. I just want to talk more about sleep because sleep is something that is really important in relation to fatigue. And sleep challenges are something that, a huge amount of our population are experiencing, and it's often underestimated and underreported. The literature would tell us that between 15 and 30% of people are experiencing sleep difficulties, and usually more women than men seem to experience sleep difficulties. But, again, it's not a one size fits all. There's individual needs and requirements. Some people need as little as 5 hours sleep at night time. Some people might need 9 or 10 hours sleep. But sleep is usually described as something that's restorative and something that's helpful and essential in our lives. It's as essential to humans as air, water, and food. So it's a really important topic for us to discuss in line with fatigue. Poor sleep and psychological difficulties often go hand in hand, as do poor sleep and concentration challenges. Often if we're experiencing low mood or anxiety, that might be also connected with maybe having trouble or having difficulties sleeping. Sometimes people have experienced difficulties with sleeping for a long, long time. And sometimes that's new when somebody gets a diagnosis of a disease. So it's worth having a conversation with your GP maybe about, or it's worth researching it and looking at it, in a little bit more detail to see if there's something that you can do to help you with that. So again, I'm going to talk a little bit about that today and offer some suggestions, but again, it warrants a much bigger conversation. Poor sleep is often associated with irritability, and it can be challenging and very difficult to continue to work and to do a full day's work, and it's difficult and challenging on relationships. It's associated with a reduced quality of life and worry, and then people worry about the poor sleep as well as maybe worry that has been impacting on poor sleep. So sometimes medication in the short term can help with poor sleep, but it's not recommended in the longer term. Usually there's other strategies like sleep hygiene that can be helpful in the longer term. CBTI can be really helpful, looking at your sleeping habits or your sleeping issues in a more detailed way, and trying to challenge your thoughts maybe around sleep. Sometimes we have unrealistic expectations as well, and that can be sometimes some things that sometimes can get in the way of poor sleep. So sometimes it's unrealistic for us to expect that we will sleep all night, every night. Most people wake once or twice during the night, and that's kind of within the normal range. Sometimes psychotherapy can help if we're experiencing poor sleep, because if we're worried and worries are interfering with our sleep, having that space or somebody to talk to can be helpful. And complementary therapy, something like gentle massage or aromatherapy, can also be helpful. But again, make sure that the person that you would attend for complementary therapies are trained appropriately in the complementary therapies that are safe for your disease. And check it out with your medical and nursing team as well. So what helps sleep? Well, when we talk about sleep hygiene, what we really talk about is many, many things. Well, the first thing that might be helpful to consider or look at is your environment. So is your environment conducive to sleep? Have you got a comfortable room, a comfortable bed with comfortable bedclothes? Is it quiet? If it's not quiet, maybe use some headphones or earplugs to help you. Is the temperature of the room not too hot and not too cold? The research would tell us that if you're too hot, that it's difficult to sleep. The recommendations would be that you try and have a wind down routine in the evening and have that every evening. So something like a warm bath 1 to 2 hours before you go to sleep, maybe a snack, but not a heavy meal or not a spicy meal late in the evening. And some research would give us an indication that milk can be helpful at night time because there's an ingredient in it which can help sleep. Have a regular sleep-wake time. So this is where the napping that I mentioned earlier on in the presentation can interfere with sleep-wake time. So go to bed at the same time every night and get up at the same time, and keep a daytime routine can be really helpful even at the weekends. Try to go to sleep when you're feeling sleepy as opposed to when you're feeling tired. Because if you're lying in bed trying to go to sleep, that can actually be counterproductive and can interfere with the ability to go to sleep. If we get caught up in a kind of a cycle of worry and worry about our sleep, it can actually get in the way of us going to sleep. So again, sometimes some distraction techniques can be really helpful, and distraction techniques like counting backwards from 300 in threes, or thinking all the names of the alphabet starting with the letter A, then go to letter B, then go to letter C. The reason why we suggest distraction techniques is that very often if we have difficulty going asleep, or if we wake in the middle of the night, sometimes our mind is racing with worries and anxieties. And if we can actually move away from those worries or anxieties, it can be helpful to get us to fall asleep again. So the distraction techniques are just about distracting us from whatever it is that's worrying us. And sometimes if the intention to go to sleep is very strong, that can actually be counterproductive. So very often people lie in bed and the thought might go, if I don't go to sleep, I'm not going to be able to function tomorrow. And so that creates a cycle of more kind of stress or worry. Whereas if you probably will be able to function the next day. And if your thought can be, okay, it's okay, I've managed before with little sleep and I'll be able to manage again. And maybe I'll be able to sleep better tomorrow night. Exercise can be helpful in improving sleep, and getting into the habit of engaging in relaxation techniques in the evening can be very helpful as well. Just a point around relaxation techniques. Sometimes we can try too hard and we can be perfectionistic about that. And so, try to practice relaxation techniques. They may not work in the beginning. And so it's about being patient and kind with yourself and give it another go or give it a try. Lots of people find meditation helpful in terms of relaxation, but it's not a meditation. It's not meant to help you go to sleep. But it can be helpful in terms of a routine or a way of managing day-to-day challenges that are in your life. Strengthening the sleep-bed connection is really important. If maybe you've spent a period of time where you haven't been well and you spend a lot of time in or on your bed, maybe looking at television, on the phone, paying bills, and maybe working, that can actually reduce or weaken the sleep bed connection. So try and keep your bed for sleeping and sex only. Try and keep your devices out of the bedroom and leave your mobile phone, your laptop and your iPad outside. Maintaining a healthy diet, having good nutrition can be helpful. And even if you don't sleep well the night before, maintain a daytime routine as long as it's safe and manage worries as best you can. Sometimes it can be really helpful in that notebook that you have that I talked about earlier to keep that notebook by your bed. And if you're awake at night time or you're finding it difficult to go to sleep, and sometimes you're worried about forgetting something the next day or worried about making an appointment or worried about collecting something or indeed doing a task, write it in your notebook so that the next time that it comes into your head you can say, no, that's in my notebook, I'll check it tomorrow, I won't forget. Thank you very much.
Thank you, Mary. I'm sure that your presentation is going to be an enormous help to all those patients who struggle with fatigue and sleep problems. We're really grateful to you for giving your insights in how to cope with this. And now it gives me great pleasure to welcome Pat Murphy, our patient speaker. Pat, I really admire you. When I first spoke to you about doing this talk, you were a little discombobulated by the idea of being filmed. You told me that you would prefer pigeons on a shelf. But Pat, having heard you in Cork last year, I know that everybody listening today will get an enormous amount from your talk. Thank you, Pat.
I was diagnosed with ET 13 years ago, and I came under the care of Dr. O'Shea and Dr. Duggan in Cork University Hospital. The first medication they prescribed was a drug called Exigrid. Now, Exigrid and I were not compatible. Maybe some of you listening have taken the drug, but I had hallucinations. Some of them were good and some of them were very bad. So the Exigrid was stopped and the drug was changed to a drug called Enegrelite. And it and I were compatible. My platelets settled down and everything was going well. Now, there's something about that phrase, when everything is going well. I've been 3 years on it and suddenly I got cellulitis on my cheek, which necessitated going into the CUH and having an antibiotic. With the cellulitis, I also got cancer spots. That was a result of working in the sun all down my left cheek, which necessitated surgery. I came at that stage under the care of Dr. Leslie Ann Murphy, dermatologist. My platelets were not, surgical team were not happy with the level of my platelets. So the medication was increased. The platelets settled down, and the surgery team were happy. So I was opened from my cheekbone to my jawbone, which was quite a brave decision for the medical team to make. It was one of the very hot summers we had, and I couldn't go out into the sun. I actually couldn't do anything. I was afraid of getting infection. At the time, I was putting a new kitchen in my house, and I needed to finish it. So I sat down with my wife, Lynn, and it was agreed that she would finish little hardwood beads and little mouldings, glue them, and she knew how to use the drill. And of course, she did a great job. And just to upset the gender balance, under my supervision, of course. Now, there's one thing I could do, and those of you listening will hate me for saying this, but I could iron. Under her supervision, of course, just to get the gender balance back again. Now, the whole secret of ironing is, I have a kitchen, there's a granite top. Put the iron on the granite top, the tap is beside it. Beside that is a CD player, and you take out your favorite CDs. Now, my favorite CD at the time of ironing is Luke Kelly. So Luke and I sing Raglan Road. We do a good job in it. He's a bit slow, but, he catches up. After Raglan Road, we do Joe Hill, the great mine worker, union man. But now the next one we do is The West's Awake. Now, The West's Awake is like a national anthem to me because I am from the west of Ireland. So I'm conducting Luke, and I'm ironing and conducting Luke and waiting for him to catch up with me. And the two great lines in The West Awake are, "But hark a voice like thunder spake, the West's awake, the West's awake." Now, the volume was so loud that you couldn't smell the shirt burning. I have a series of size 16 shirts with burn marks on the sleeves, and I'm offering buy one, get one free. Because if you can go out and buy a pair of jeans with the knees ripped out of them and rips all the way up the leg, surely a shirt with a couple of burn marks would set a trend. So the other cheek, surgery followed on my right cheek, and the same procedure followed. Nobody in my house rushed to take over the ironing. So I healed. I continued going to the C of H to hematology. And one day I'd been going at the stage for 6-7 years, knew the nurses, knew the doctors, and fell into a routine. And one day I arrived, and the consultant said to me, "Pat, we can actually do no more for you." And that was quite a shock. Not that there's anything wrong, but they said that the medication was as much as they could give me about it to stabilize my platelets, but that there was a specialist coming from London, and she would take my case, that the files would be handed over. So the lady from London, as I will call her for the time being, arrived in the Mercy Hospital. I got my appointment letter, and I thought, I need to look sharp. So the first thing was into the pawn shop, took the suit out. It was there for so long, it was back in fashion again. Skinny trousers and all. Happy with that, and I said, I need to find a pharmacy. Into a pharmacy, young lady, most pleasant in the morning. I said, "Good morning, may I have some Old Spice, please?" She looked at me and she said, "The Oriental Spice shop is 3 doors up." At that stage, I thought there's no point in asking for Brill cream. So I arrived at the hospital, and went to the nurse's desk and handed up the prescription I brought with me. And the nurse said, "Fine. The lady doctor will be with you in a few minutes." And I sat down. Lady from London arrived. How would I know it's from London? Because the fragrance of Chanel when she walked in, you absolutely knew this was the lady from London. We introduced ourselves and we sat down. And this is the most astute medical observation that I have ever experienced in all my years going to doctors. She looked at me and said, "You don't wear socks?" I said, "No, I've worn socks for 30 years. The weather was beautiful." I looked at her and said, "You're not wearing socks either." So we were kind of a one-all situation. I then asked her, where would I inject the prescription? Regrettably, the prescription hadn't come as she had prescribed it. The volume was greater. And she looked and she said, look at you, she said, you have legs like a chicken. Now, I don't know if anybody of you listening, after a couple of drinks on whatever weekend night that you're out and you pass a Kentucky Fried Chicken, and you have the Kentucky Fried Chicken deep fried, which you shouldn't have, and the chips and the mushy peas, and you're in your element. From that moment, I've never eaten a Kentucky Fried Chicken. So the lady from London looked and said to me, look, you have a fine gut. We'll inject it there. I thought, great, lovely. You know, at least she didn't call it a beer belly. So the consultation was over, and I had to go and get the prescription changed. And on the way out, something said to me, go on, say something, because she was very apologetic. And you know, on one shoulder, you have an angel whispering, leave it alone. And on the other shoulder, you have a fella with a prong, and he's prodding you. And he says, go on, go for it. And Tennyson's famous poem, The Charge of the Light Brigade and Into the Jaws of Death, flashed through my mind. I couldn't leave it alone. Straightened up to my full height, cleared my throat, and the lady from London's identity will now be known. I said, Dr. Clodagh, this would never have happened on Dr. O'Shea or Dr. Duggan's shift. Lads, I should have kept quiet. I got the most angelic smile, could melt the ice cap. And this angelic voice into my ear said, and why do you think they wanted to get rid of you? So it was game, set, and match to Dr. Clodagh. I moved on to medication called interferon, which is a self-inject syringe. So things were going well, that phrase again. Thank you all for listening. Take care.
Thank you, Pat. Your talk really lived up to expectations, and I'm sure so many people will have enjoyed hearing it. I'm now going to introduce Myela, and she's going to talk about her diagnosis with ET and how she became involved with MPN Voice and how that has helped her. Welcome, Myela.
Hi, so my name is Myela. So I moved over to Ireland around 10 years ago. So I'm French, and I've been having a great life so far altogether. Since I was a very young child, I've always been more subject to infection, sickness, asthma, and I've been living fine with that so far. In January 2019, after getting infection after infection, I felt that something wasn't right, and I requested from my GP to get full blood tests. That's where they were able to see that my platelets were very high, higher than normal. So they've asked to come back and perform a second test, and they were showing even higher platelets. And so my GP requested help from the hematologist department at the Mater Hospital here in Dublin. So they arranged for me to come for an appointment a few months later. And as some of you know, in public sector in Ireland, the waiting list can be quite long. So there I had a blood taken, and they arranged for me a follow-up appointment for about 5 weeks later. So that was about in May. And on my birthday, early June 2019, I was having a celebration with my friends, and I noticed a letter that had come a couple of days before. And they actually, it was actually the hematology department asking me to come back 2 weeks sooner, which was a bit frightening to me. And so I have a few GP friends, and they mentioned ET, essential thrombocythemia, and but they said like, oh, don't worry, it's just a matter of being mindful whenever you take you get on a plane, and that should be it. And so on June 19th, I got to the appointment, and in the waiting room, a gentleman was on his return appointment after kidney cancer. And we had a lovely chat, and he helped me with the stress level. Yet I was worried to be on the same waiting room as him. My hematologist, Dr. Sumong, then received me to her examination room. She announced the diagnosis and a rare blood condition that I was tested positive for JAK2, And she explained that I was in an early stage, low stage, and it was manageable and that it would be okay. And I remember responding, I'm relieved at least it's not a cancer. And that's where she explained that MPNs have now been classified as blood cancer. And as you can imagine, and we have gone through this, I started to panic. She then handed me a leaflet from MPN Voice and explained that I could find all the information about my condition in there. She also explained that I could find support and that it's such a rare condition that it's difficult for practitioner even to understand and have the knowledge to help me through this. And I was frightened. I didn't know what to do. But then she put me on aspirin and scheduled for me a bone marrow biopsy. I was lucky to have support from friends and family. I was lucky that my work and management understood that I needed to process this all and that I would need time. I didn't know what to think any longer, and I was totally lost. I decided to reach out to MPN Voice, and I was lucky to have the amazing Maz respond to my questions, even the most common ones. I found with this contact that I wasn't alone and that this is so important, support and empathy. And my sister jumped on the first plane from France and was with me on the bone marrow biopsy day. I will never thank her enough nor forget about this gesture. I was back then pretty much by myself in Ireland, no family around. And the results showed that my bone marrow was healthy. So that was a great news. But then what's next? And still now I dread every quarterly checkup, worrying about what could happen, what will happen, the weight, what hasn't happened. I think we've all been there. My hematologist has been absolutely fantastic. She's been reassuring me, making sure I cope on and understand this all. She told me I would need personal life changes, which to this day I'm still working on. In September 2019, I received the news that a forum would be held in Belfast by MPN Voice. I decided then to sign up for it. I straight away, when I got to their website, I signed up to newsletter. And Maz then emailed me back to confirm I was good to come over, even though I'm part of Ireland and not the UK. I jumped on an early bus to Belfast and I arranged to stay at a friend's house for the weekend. There I found that I was really not alone, found support. I got answers to my questions that were still unclear to me. It was clear in my head. I could also feel that patients were keen to bond and everyone was understanding each other, which was a great feeling. I still had issue accepting it all though. As you can imagine, I think we've all been there, as I'm saying all the time. But in March 2020 came the pandemic. With the first lockdown, it has been hard to understand what to do, in which category to put yourself in. We didn't even have to ask MPN Voice. They proactively sent us the relevant information through their newsletter. I was able to find responses to all my questions, not even having to ask anybody. Then they offered a patient forum online, to which I attended. I was lost, to be honest. It's hard still to digest my diagnosis and had gone through quite low stages mentally speaking. During this pandemic, I'm gonna go back. During this patient forum in July or August, they had mentioned that they needed funds. They needed funds to keep going and help with research. I told myself then I needed to do something to help because MPN Voice disappearing would not be an option. I thought about it for a couple of days, and I'm part of the traditional Irish music scene here in Ireland, and I know a lot of musicians, and I decided to start a fundraiser online involving my musician friends. I reached out to MPN Voice once more, And the relationship was amazing. So Maz and Nona walked me through the steps to create a fundraiser page, set the concert date, every detail alongside everyone involved, the different musicians who performed, those who filmed, the people who produced the film itself. MPN Voice and the board have supported us every step of the way, which was absolutely fantastic. And this generated a lot of excitement, and for my personal experience, I must say, full acceptance of my diagnosis, which was extremely important. So I would have not been able to be okay living with this condition if I had not come across MPN Voice. I'm sure of it. A few months have passed now, and my platelets are stable at the moment, which is great. And it's all day by day. And my professional career is going great, personal life as well. And I've made peace with myself, and I could never thank enough MPN Voice, my hematologist, and the people around me enough for their patience and support. I'm aiming to organize more fundraiser now for MPN Voice, but also for meaningful charities that help others.
Thank you, myela. And again, so many thanks for all that you've done for MPN Voice since your diagnosis. Time now for questions and answers. And the first one I'm going to give to Mary. Mary, Sinead asks, can you give any tips on communication?
Thank you, Nona, and thank you, Sinead, for your question. It's a very important question because communication is such an essential ingredient in relationships, whether that's a relationship with, our family, our partner, our friends, but also in our, in our care and in our relationship with the medical professions, our doctors and nurses. So I suppose clear communication is really important, and a little bit like what I said earlier, it warrants a much bigger conversation, but I suppose for the purposes of this morning, I would just say things like, with family and friends, if people offer to help, maybe accept help. Think about the people in your group, in your support network who might be good at different things. So maybe somebody would offer to help, collect the children from school or give you a lift somewhere. And then other people in your group would be better at different things. Maybe somebody is a good listener, maybe somebody is not good at listening. So maybe ask the people, think about, what is my friend? What are they good at? What would they like to do? Because the reality of it is that most people want to help and want to be a good support to you. So think about that in terms of that group. Communicate with your family and your partner if you are experiencing sleep difficulties or if you are experiencing a lot of fatigue, because maybe they don't know that you're not sleeping very well. So maybe they don't understand or know why you're feeling irritable. So we talk to people, and it can be really helpful to let everybody know. In terms of communicating with your medical team or your nursing team, I would say things like, when you attend for appointments, maybe tell the team at the beginning of the appointment that you have a lot of questions. Keep a notebook, keep your questions in that notebook, and maybe prepare for that appointment in advance by, reducing the number of questions you have or making them, concise. That's just a brief kind of answer to that question, but thank you, because communication's really important.
Well, thank you, Mary, for your answer. Tim, I've got a question from you from Elaine. How is the money raised from the Ireland concert going to be used?
Well, thank you, Elaine, for that question. As a committee, we have an overall aim of trying to direct funds that we raise through patients and general donations for research purposes. We have ongoing expenditure of about £100,000 a year, and we try to find the money from companies such as pharma companies and corporate donations. So ideally, we use money from Ireland and other donations for research, and we have a number of research projects on the go at the moment. And of course, we'd like to thank you very much for the tremendous efforts for raising the 3,600 odd euros, which is a tremendous help, and we'll do our best to direct it in the right direction for you. Thank you.
Thank you, Tim. Tara, a question for you, and it's from Ethne. I have regular fatigue and brain fog, now diagnosed depressed, needing antidepressants. Is this common for MPNs?
Thank you, Ethne, for the question. I suppose firstly, fatigue it's a common symptom that people with MPN tell us they experience, and it can be closely linked with brain fog and also depression. So the more fatigue somebody will feel, the more difficult they'll find it to think and maybe to make decisions. And similarly, I suppose people can find themselves feeling sad, frustrated, even upset at the impact that fatigue has on them and on their life and the changes that have occurred as a result. So I suppose just to say firstly, fatigue, brain fog and depression can be very much closely linked. And also I suppose we all have our own backgrounds and our own life stories, and so it's not the only cause of depression. But I hear Ethne talk of and mention antidepressants and needing them, and maybe that's something that her GP or her psychiatrist has recommended. And medication is one key treatment for depression, and particularly recommended for people who experience moderate and severe levels of depression. However, I suppose also it's recommended that a combination of psychological or talking therapy and medication is best to achieve longer term benefits and overcome depression fully. So that would be, I suppose I would be recommending that Ethne, if she hasn't already, or if it's not already been recommended to her, maybe discuss this with her healthcare team or GP and explore options for maybe talking therapy alongside antidepressants.
Thank you very much. Avril, a question here for you from Elva. Are ET patients at elevated risk of clotting problems if they contract COVID-19? Are we there, Avril?
No, sorry, apologies. Thank you very much, Elva, for sending that question in, and it's a very good question, and one, I suppose, which we are getting asked a bit lately in our clinics. So yes, I suppose they are, as we know, COVID-19 poses an increased risk of clotting, as does ET. So sometimes prophylactic anti-clotting medication may be needed for ET patients if they contract COVID-19. And of course, then we also suggest strict adherence to treatment goals for patients with ET. So this is aimed at decreasing risks of their or risks of clotting.
Thank you very much. And I'd now like to go to Mary again. And there's a question here from Eilish. Dealing with fatigue, which can happen occasionally. Have you got any tips on that?
So I suppose, thank you, Eilish, for the question, and thank you, Nona. I suppose a bit like what I said at the beginning of the presentation, there's multiple reasons why somebody might be experiencing fatigue, and it might be, a medical reason, and it might be a psychological reason. And so I'd probably check that out first, see what maybe is contributing to the fatigue. And it mightn't be just one thing, it might be, a multiple of things. And a little bit like what Tara has just said about the connection maybe between fatigue and low mood, and maybe between fatigue, low mood and concentration difficulties. So, I do think that warrants probably further investigation, definitely worth talking to your team about that. I suppose most of us experience fatigue in our lives anyway, whether we have a condition or not, you know, if we've had a particularly difficult or busy time. So, you know, it would really depend on what's happening. And I guess at the moment, in the current context and with COVID, you know, I guess we're all fatigued from the situation that we're finding ourselves in, and the challenges that we're all experiencing. So I can't answer that directly. I think there could be multiple reasons for Eilish's fatigue.
Thank you.
Thank you.
I know as a patient here, having been shielded now, it will be 5 months of this year, that you know, I think for one thing, it's really difficult sometimes putting structure back into your life. You know, if you're shielded or cocooned, as it's called in Ireland, you do lose that structure, and I think that can make you feel tired. It certainly has in my case, but you know, I think we all experience it differently. But thank you, Mary. Tim, a question for you here. It's from Pete, who says, how many research projects are you supporting, or MPN Voice supporting?
Well, thanks for that, Pete. The straight answer is 2. The first of these, which is the epidemiology study known as Mosaic. Patients often ask, why do I have the disease? And Mosaic is a pilot study into finding the best way of answering this question. We started supporting the study in 2013, and has so far provided a £90,000 grant in support of its phase 1 study, and we further committed to supporting £75,000 for its phase 2. And you may be interested to know that phase 1 of Mosaic was led out of Belfast, and that phase 2 will include patient participation in both Cork and Dublin. The second project is a clinical trial known as Mithridate, and this is a 10-year multi-centered international trial looking at the effectiveness of the ruxolitinib drug versus hybridized or interferon as a first-line therapy in high-risk polycythemia vera. And we've committed £10,000 a year for this clinical trial for each of the 10 years. And of course, we've supported various of other trials over the last 5 or 6 years. Yeah, we'd like to do more, but we are a very small charity, and so our funds are limited. Yeah, but we will do our best.
Thank you, Tim. Thank you, Tim. Tara, a question for you. How do patients access your services?
Unmute. Yeah, that's a good question. I suppose the service, we'll say we're based in Cork, and the psycho-oncology service is accessible to all patients. So it would be about discussing with your maybe clinical nurse specialist or your consultant, and they would then pass your name on to me. Yeah, so it's very accessible.
Thank you. And may I ask Mary the same question?
For the service that I work in, it's very similar to what Tara has just said. The service that I'm involved with in St. Vincent's in Dublin, the referrals come through your haematologist or your clinical nurse specialist or advanced nurse practitioner. And so just discuss it with your team. And then, yeah, we're very accessible.
Thank you. And to Avril, we've just had a question from Anna Rose asking if ET patients are advised to cocoon.
Yeah, that's a very good question, and I suppose you know, I won't, it's a question that I can't, I suppose, not knowing your exact history, I wouldn't directly, but in a general answer, and I suppose it's something you'll need to discuss directly with your consultant and your team, but taking in, I suppose, the guidelines that the HSE advisors have advised us, you know, the over 70s group should be, you know, cocooning or restricting movements, and then having an MPN diagnosis, you know, whether you're on medications you're on. If you're on, I suppose, patients, we'd be a little bit more wary with patients who are on ruxolitinib, you know, in relation to their immunity. So it's just, there's a few different variables there, so I wouldn't be able to answer that directly, but I would certainly advise talking to your consultant or your team directly.
Okay. Thank you, Avril. Are there support groups for MPN patients that in Ireland that they can access community help?
That's for me, is it, Nona?
Yes.
Oh yeah, sorry. MPN patients that they can access community help, is it?
Yes.
Okay, so so we would always have used MPN Voice, and we would have always used the information, and recommend patients to access the website, you know, to chat to other patients and get some support from other patients. Unfortunately, in Ireland, there's no specific MPN patient forum or patient group, sorry, here in Ireland. So MPN Voice would be the one we'd always refer our patients to. In relation to in the community during COVID, there's certainly community supports available, and you know, if the patients log on to the HSE website, they'll be able to access their local community supports there also, and also any patients that would can liaise with, you know, their health practice and liaise with their public health nurses would be very good in putting any of those in place.
Thank you. I would just like to mention the MPN Voice buddy system. I, in fact, buddied somebody years ago with ET from the west of Ireland, and that's accessible to anybody who wants one-to-one support from somebody who's been diagnosed with an MPN for at least 2 years. And it's a matter of just contacting Maz, who holds the list of buddies and people wanting to be buddied. So we match up people as closely as we can. My own case, I really enjoyed buddying this person from the west of Ireland because I have very strong family roots there, so it made me feel at home again. But anyway, that's another source that's open to anyone in the world. I mean, I know on our buddy system, we are buddying people in Australia, buddying people in Hong Kong. So it's just not restricted to MPN Voice in London. And I think that's a really important point. For anybody who is struggling on their own with an MPN Voice, we are with an MPN, we are there to help during these really difficult times. Another question here for Mary. Managing fatigue and lack of concentration, the lack of concentration. I think sometimes it's described in MPN terms as brain fog.
Thank you, Nona. Yeah, very important again. And sometimes people struggle with concentration difficulties and concentration challenges, and it's not unusual. But there's probably a couple of ways or strategies that can help with that. And so one of them might be to use a wall planner or use a diary, whether that's a written diary or a written notebook, or something on your phone. So maybe use your devices to help with that. You know, things like getting some exercise and getting a good night's sleep and eating well. So those basic things are really important. If you don't sleep well, it's very hard to concentrate. Other strategies might be things like using a medication box for your medication, making sure that you're involved in conversations. You know, if you feel that you're left out of conversations, maybe asking somebody to repeat what they said or asking a question. And you know, at the moment, if we're doing or having conversations with other people online through Zoom or FaceTime, sometimes that actually can be helpful to stay in a conversation. Whereas if you're physically present, sometimes it's much easier to remove yourself from a conversation. There are other things like sometimes multitasking can be unhelpful. So maybe focus on one task at a time, and maybe reducing the amount of distractions that are in our environment, you know, when we're trying to focus on a task. Sometimes when people talk about concentration challenges, they might talk about having word finding difficulties or difficulties focusing on a new task. So, you know, if some of this is new for you or it's interfering with your ability to function, I definitely mention it to the team, and definitely mention it to your GP or whatever medical personnel that you're in contact with. Some of the other ways that might help would be, you know, leaving important items like your phone, your keys or your remote control in the same place. So, you know, don't leave them in different places all the time. Leave them choose a particular shelf at home or a particular spot where you leave that item and leave it there all the time. If it's, you know, maybe parking in the hospital car park when you're coming for visits, you know, there's strategies you can use, like maybe using the same floor or using the same area in the car park, or maybe putting a ribbon or something like that on the aerial of your car so that you can identify it quickly. I mean, I struggle with that myself sometimes when I come out from work. I can't remember where I've parked the car. So they're just some little ideas. The American Cancer Society have some helpful tips on their website for that. But it is something that's a feature, and it can be very distressing. So yeah, have it checked out. Again, talk to people about it. So they're just a couple of things. Tara might have something to add there to that. I don't know, maybe there's something I've forgotten, Tara, that you've thought of.
I thought that was very comprehensive. Those were very comprehensive tips, Mary. The only thing I think I'd add to that is I suppose something that can help with concentration difficulties, and also something that can help with how concentration difficulties can impact. So for some people, it can make them feel really frustrated, particularly if this is new, and you know, it can, you know, result in them feeling upset and maybe quite sad about it, about the changes. So one thing that I would recommend, in addition to your comprehensive list of tips, would be a mindfulness practice. Is something that, you know, some patients have told me actually can give them some relief from the emotional impact that concentration difficulties can have, and can also help them focus. So you mentioned, Mary, about multitasking and that not quite helping if somebody has, you know, reduced concentration. Actually, mindfulness would completely agree with you, and it would be about focusing on one thing at a time, and mindfulness can really help with that.
Yeah, and the other thing I forgot to mention there earlier was maybe doing some word games or card games, and that might be helpful as well.
Thank you both. Tim, a question has come in from Maura. Are you symptom-free after your transplant?
Well, thanks, Maura. I'm pleased to say I am. Technically, I'm cured. That's not to say I don't have a few issues from the transplant. It wasn't an easy ride initially, but I am pleased to say 9 years later I'm fine. I like to keep fit. I think that's important for all of us, to remember to try and keep fit, look after yourself. Yeah, but thank you for that question. Yeah.
Thank you, Tim. I think it's worth saying here now that research has come on so much. Certainly, I was diagnosed, well, it'll be 30 years ago next year with originally ET. And even with the bone marrow transplants, Tim, I think you'd agree now, medical science has come on leaps and leaps and bounds, hasn't it?
Oh, definitely. So in the 9 years or 10 years since I decided I needed a transplant, a lot of these drugs just weren't available. You know, we really have to thank the pharma companies for bringing these drugs forward so quickly. There's so many of them now, it's difficult to keep up with how many there are, all the clinical trials that are ongoing. It's just truly remarkable, and I think there's lots of hope for all of the MPN community.
Thank you, Tim. Avril, can I go back to you and ask you a question that's come in from Margaret? Are people who are taking hydroxycarbamide and advised to use factor 50 sun cream at risk of vitamin D deficiency?
Thanks, Margaret, for your question. That's a very good question. As you know, hydroxycarbonide or Hydrea, when a person is taking that, we would advise that they'd wear the highest sun factor available, factor 50, because one of the potential side effects with Hydrea is sensitivity in your skin, darkening of your skin, and it may increase your risk of skin cancer as well. As a result, yes, you're right, Margaret, you can become vitamin D deficient, therefore, so we would advise patients they can get their vitamin D levels checked with your GP, and the GP or your general practitioner can replace it if needed.
Thank you very much. And we have time for one more question. I would actually like to thank everybody for the questions that have come in. I know Maz will get back to you and we will get an answer to you. It won't be immediately, but I promise you that it will happen in time. And I'm just looking at a list here, and I think there's a question here. Is there any data on how many people with MPNs have coped with COVID infections? Do lower white cell counts affect COVID impact? Is anybody able to answer that?
There is some data available thus far, and the vast majority of MPN patients who have contracted COVID-19 have coped fine. Most of the medications for MPN patients wouldn't be considered very strong immunosuppressants or medications that would lower your immune system, most of them. But however, we would be wary of patients on ruxolitinib. And then in relation to the white cell count, I suppose there would be a concern for patients if they were neutropenic. So neutropenia is when your neutrophil count, which neutrophils are part of your white cells, which fight off infection. If they were low, there would be a concern at that stage.
Thank you very much. And Tim, one final question for you about the MPN Voice community. I know that you put in a lot of work. Do you enjoy it? Do you have fun? Do you have laughter?
Not when I'm standing in front of a video screen, but generally, yes. We've got a good team. We had our Christmas party on Thursday night via Zoom, which was good fun. We all dressed up. But no, generally it is good. Yeah, it's amazing how much effort goes into supporting everything we do. Again, I have to reiterate, we are a small charity with £100,000 a year operating costs, but the actual time spent by people such as yourselves and the fundraising committee, the medical committee, is phenomenal. And if you were to value their time financially, it'd be a very big organisation. So I know we've got a fantastic website which is about to be relaunched because we had to, not because we want to spend money, but we had to do that. But yeah, it's fun most of the time. It's not without its stresses, but yeah.
Can you give the date for the relaunch of the website? Because I think that's important.
Yeah, it's planned for actually next Friday, the 4th, the afternoon of the 4th. And we'll be around over the weekend just in case there are any problems. We're not expecting any, but it's very much the same content, but it's a total refresh. So hopefully people will enjoy it.
Thank you. It now leaves me just to say a huge thank you to you all on a Saturday morning, giving up your time and being with us. and also to our Irish friends. You're so much part of our community. And I have to say that COVID permitting and perhaps a vaccine permitting, Maz and I are really, really looking forward to being in Galway on the 12th of June next year. I'd also like to extend thanks to Pat for his talk, and to myela. And myela, you are such a star for ongoing support for MPN Voice. And also two other people, the group from Novartis in Ireland, who have been amazingly supportive to us. As you probably know, we were going to do a patient forum with some clinicians, doctors talking, and that had to be abandoned purely because they are so busy with the uptick in COVID. And, you know, the support that Novartis have given us to put this patient event on means a lot, I know, to so many people, and we get so many bits of feedback which we will be sharing with the team here about how helpful that is. So all it leaves me to say is a huge thank you to everybody. Have a really good Christmas, and the most important thing of all, stay safe. Thank you.